Well, hey, good morning. My name is Mike Eagle. I'm a physician assistant on the total joint team here at Vanderbilt. And so glad to be with you this morning. I'm doing this recording via Zoom because we can't be together in our total joint class. I'm here in the Franklin location, and this is our total joint classroom. Normally, I'd be teaching a room of probably a dozen of you, and sorry I can't meet you face to face. Hopefully I'll get to see you at your post-operative visit. But the purpose of this video is to educate you on joint replacement. And there are several reasons why we do a joint replacement class. If you'll just bear with me, I'm gonna share my screen with you, and that way you can see some of the slides that normally I show during the recording. So we're going to go ahead and I'm going to show you the first slide, and so this is a picture of Vanderbilt Hospital, which is the main campus. A lot of you come to see me at the Franklin location, which is a convenient location down south for a lot of our patients that are coming from places like Lawrenceburg and Tullahoma and places like that. So normally what we would do is we would see you here for your preoperative visit, as well as your what we call your VPAC, which is your pre-anesthesia visit, and as well as your postoperative visit to try to minimize the amount of travel that you have to do. So this is a picture of our main campus, so downtown. Some of you actually, if you're viewing this recording, may actually go to a class or would go to a class downtown with Angela Combs, who's on our joint replacement team as well, that teaches the class downtown there. But in any event, what I want you to know about this picture here is that this is our main campus. This is a main hospital, and we have a parking garage across the street. In fact, we have free valet parking if you want to come on the morning of surgery and take advantage of that. That would be wonderful. And then you would just go into this main building. If you get lost, since it's a big campus downtown, the emergency room is right next door, so it's easy to find, and then you just go right through the front doors. I'm going to show you some more pictures later on of the actual inside of the hospital and what to expect. But here's what I want you to know this morning. Thinking about joint replacement surgery in general, it can invoke fear and anxiety just going into surgery in general, and we realize that, and this is one of the reasons why we do a joint education class, to hopefully answer a lot of your questions, to maybe alleviate some of that anxiety going into things. And so we certainly view this as a partnership between us and you. We want to make sure that you have a great outcome, and that's why we do this class. And so we're here for you. And I know this, I can tell you that joint replacement is very predictable. People do very well. Both knee and hip replacements do very well. You know, you get to the point where the arthritis is just debilitating. You don't want to go to the mailbox and get the mail anymore. You don't want to go to the grocery store to get the groceries. You don't want to get out in public just because you know, your joints hurt so much. And we've tried all the conservative things. We've tried injections and physical therapy and medications, and now we're at a point where you're ready to go ahead and get your joint replacement. So I know you're going to do well. In fact, I will tell you this, that once a joint is put into place, there's nothing you can do that will hurt it. It's designed for you to get up and put all your weight on it right away, and for you to walk on it right away. Here's a little model of a knee replacement and a hip model in the background. But once these components are in there, they're in there. They're designed for you to put 100% of your weight and walk on them in most all cases. And so we're going to get you up walking in the hospital the day of surgery or right afterwards. Even if we do this as an outpatient, we'll have you walking on it right away. I will tell you that there's a lot of physical therapy that's involved afterwards, so I'm not going to make it sound like it's super easy. and so we put you in physical therapy 3 times a week for 6 weeks afterwards, and you'll be working with the therapist on getting your muscles strong and getting you up and getting you going. But we know that you're going to do well, and so we're here for you in that regard. So I'm glad you're part of this class today. I'm going to go ahead and move on to the next slide here. And one thing before I go forward is when you do come to the hospital, I do want to remind you there's 2 things that you would need to bring with you and to leave in the trunk of your car. One is a walker. You should have gotten a prescription for a walker, and if not, just let us know, and we'll be happy to. And right now, if you're viewing this, probably need to fax that in to a medical supply company for you, or walkers. A lot of people will go to places like Goodwill and get their walkers there. I've heard of people getting them for $5 at Goodwill. So you'll need a walker with the wheels on the front. And you just leave that in the trunk of your car. If you're a hip replacement, we'd also like you to bring a pillow and leave that in your car as well, because you'll need those for after surgery. We will provide a walker while you're in the hospital during the surgery. So that's what you would need to bring. I'll talk about some things that you'll actually need to bring to the hospital in another slide here. So. So I want you to imagine yourself, it says, the slide says here, a year from now, but really I want you to think even a month from now, a couple months from now. What is it that you like to do? Do you like to get outside and walk the dog? We talked about those things like going to the grocery store and just kind of getting out and doing the things you like to do. Our goal is to restore that quality and that functionality, quality of life, where you can get out and enjoy the nice weather. You can get out and walk again. You can ride a bike. You can take a swim. You can do all of those things that you like to do. And so that's our goal, is to get you going. So I want you to keep that picture in mind. And I know you will get there. So it'll be tough. The first couple weeks sometimes can be rough. It can be difficult, just recovering, but it will get easier and easier and easier, and we're here to walk you through that. So I want you to think of that end piece of the puzzle there. So we have this acronym, ACMT. I'm going to start with a long, complicated word in the middle. Mupirocin, that's an antibiotic ointment. Now, you should have received a phone call from your pharmacy. We usually send that into your pharmacy ahead of time. What that is, it's an antibiotic ointment. You take a little tube of that, and then you take a little dab and you put it on the end of a Q-tip, and then you swab your nares just on the inside portion of your nose, right where it flares out at the bottom. You don't need to go way up in there. You just need to do the bottom of your nose, and we have you do that for 5 days before surgery, twice a day, including the morning of surgery. There's some really intelligent infectious disease physician that figured out if we do this, it actually cuts down on the risk of infection at the time of surgery. So that's why we do this for total joint replacement, is we have you do that antibiotic ointment. So you should have that at your pharmacy. Just let us know if you didn't receive that, but we always will send that into your pharmacy ahead of time electronically. Another name for that is Bactroban. So Bactroban or Mupirocin are the same thing. The next letter, I want to go back up to the top, is the A, which is avoid. So the picture here is a lady trimming her rose bushes. Not a great time of the year to get out and trim your rose bushes right before surgery. And the reason for that is, let's just imagine you get a little thorn in your skin, in your arm or in your leg or somewhere along those lines, and then that has a potential to get infected, or you get a big scratch on your skin. We're ready to do your surgery. You're ready to have your surgery. You're on the launch pad. You're ready to go. And everybody's excited. And then we see this big cut on your skin, and we're worried about the risk of infection. And we hate to tell people that we're so sorry, but we have to wait until this heals to minimize that risk. So it's just avoiding things that could preclude you from potentially having surgery. Other things to avoid, obviously, people that are sick right now, especially in these times, trying to, social isolation is a big thing. And so people are naturally avoiding others, but trying to avoid people that are sick because we want you coming in healthy, so you leave healthy. If we skip down to the bottom, the T is simply to tell us if there's anything that you're concerned about, if you have a cough, or if you have a cut, or if you have something going on with your teeth that you need to get taken care of, just let us know. And we'll work with you on getting you into your primary care physician or dentist or something along those lines to get that optimized before surgery. Again, we want you coming in healthy so you leave surgery healthy and doing well afterwards, so you have a great outcome. Now the C is clean. And so we do a lot of things at the time of surgery to really minimize that risk of infection and get that number down to nothing. And the way we do that is several-fold. First of all, we're going to do this in a state-of-the-art operating room. It's called a laminar flow room, meaning that it's just a very, very sterile room where all the air flows in a particular direction. Our surgeons utilize spacesuits, so they'll look kind of like Neil Armstrong when they're in there. You're not going to probably remember this because you'll be in happy land by that time, but it's just another thing that we use to reduce that risk of infection. So you'll see that as well. But we have, so the other thing is we'll give you antibiotics before surgery, during surgery, after surgery. We do that through the IV. Occasionally we'll send you home with some antibiotics. But we have found, even with all of these things, probably one of the best things that we can do to reduce the risk of infection is what you do beforehand, and that is to clean your skin really well beforehand. So you should have received packets of surgical wipes. In fact, they look a little different than what's on the slide here. And I'm just gonna put this on pause for a second because I wanna show you all right, give me 1 second, and I'm just gonna, I'm normally walking around the classroom to teach you, but I have a sample here for you. And so this is what these look like. These are surgical wipes, and these are a little bit different because they're pre-packaged. And so you'll receive 2 bundles of these. And so what you'll do is you'll actually use 1 bundle the night before surgery, and you'll use 1 bundle the morning of surgery. So within each bundle, you have three of these packets here. And then when you open these are pre-medicated pads. You'll pull it out. It's kind of like a Lysol wipe or something along those lines. And what you're going to do is you're going to wipe these respective areas of your body. And so the way things will work is you're going to take your last shower the night before surgery. You will not take a shower the morning of surgery. So again, your last shower will be the night before surgery or bath. You're going to wait an hour for your skin pores to constrict back down to normal, because obviously when we take a hot shower, our skin pores will expand and we want those to constrict back down. And when that has happened, before bed, you're going to take these wipes. And so what you're going to do is you're going to take 1 wipe at a time, and you're going to wipe those areas of the body. So the very first place that you're going to wipe is something called your torso, the very front part of your body. So you do your whole front part with the very first wipe. You don't need to do your face. You don't need to do your private areas. You don't have to do the armpits, but do the whole torso, and then you take that wipe and you throw it in the trash can. The second wipe that you pull out of that first packet, you're going to do each arm. So it's kind of where I do my flight attendant thing. If you want to do the front and the back of both arms, and then you go ahead and throw that wipe in the trash can. The third wipe is you're going to wipe the surgical leg. So let's just say, for example, it's a right hip or a right knee replacement. You just wipe that entire leg, front and back, all the way down to your foot and toes, and then you throw that wipe away. The next wipe is number 4. You're going to wipe the whole opposite leg in the same manner. The fifth wipe, this is where you need to phone a friend. If you have a spouse or a loved one that can wipe your back, go ahead and have them wipe your back. Or if you don't, go ahead and do it as best as you can. And then we get to the very last and final wipe, which is the 6th wipe. And that's where you're going to wipe the surgical site. So for example, if it's a right hip replacement, you're going to wipe the side of your hip right on the side and towards the butt a little bit. If it's a knee replacement, you're gonna wipe the front part of your knee on the surgical side there. So you're gonna wait for this to air dry. It air dries in a few minutes. It may be a little bit sticky on your skin, and then you're gonna put on some clean pajamas and crawl into some clean sheets in your bed. And then you're gonna sleep as best as you can the night before surgery. And then what's gonna happen is when you wake up, guess what? You're gonna do this process all over again. You're going to take that second bundle out, and then you're going to start going through those 6 wipes again, 1 wipe at a time, just like you did the previous night. After you're done with that, you're going to put on some clean clothes, and you're going to come on into the hospital. So when you get into the hospital right before surgery, guess what? We're going to wipe you down again, so your skin's going to be cleaner than it's ever been before. So hopefully that's self-explanatory. The only thing, again, that's different on this slide is that the actual packets that we're probably going to give you look a little bit more like this now. It's just pre-medicated pads instead of the bottle. So it makes it a little bit easier on you. So that's the wipe, and then you should have picked those up, or we should have put those in the mail to you. And if you did not receive those, please let us know. So you did good on this part. Usually I'll take a time for questions, but obviously you can't ask questions with that, but hopefully that's self-explanatory for you. All right, I want to talk a little bit about blood clots, and the picture on the screen is an example of a blood vessel. So on the sides here, you can see where my cursor is going. These are the walls of the blood vessel. Within that blood vessel wall, here's a depiction of a blood clot that then breaks free and travels through the venous system, becomes something called an embolus. The reason why we worry about an embolus is it can travel through the venous system and end up in the lungs, and that's what we call a pulmonary embolus. Now, this is extremely rare, but I just want you to be familiar with the terminology. This is not to alarm you or worry you. This is just to educate you. Because after surgery, you are at increased risk for a blood clot. But likewise, you are also at increased risk for a blood clot if you travel on an airline or if you travel for long distances in a car. The reason why people usually get blood clots is due to inactivity. They're sitting around and not doing much, and then the blood has a chance to pool. The way I think about this is I usually explain it this way. My son and I went kayaking down in Georgia, and we were at this beautiful river. You could see every stone on the bottom, and just crystal clear water. But I noticed that where the water went off to the side and just stagnated there in those pools off to the little alcoves, it would build up, and then you'd have algae that would form. Well, really same concept with the blood clot. The blood needs to keep moving and flowing. And so we're going to do everything in our power to help reduce that risk and bring that risk down to nothing. And one of the best ways that you can help is to start moving right after surgery. In fact, that's why we get you up and we get you moving right after surgery, because we know several things. We know it's good for your heart and for your lungs, and also for to help reduce the risk of a blood clot, and because we keep the blood moving. One thing I do want to mention is one thing that's really good to do right afterwards is something called an ankle pump. An ankle pump is where you move your ankle up and down. And what that does is it squeezes the lower muscles in your legs, and it helps actually act like a pump. So you can do that right after surgery. You can do that all day long. It will not hurt the knee or the hip. I know it's going to be a little bit weird, but I'm going to demonstrate this for you. So you want to take your ankle and just move it up and down like that. So hopefully you can see me on the screen there doing that. So that's an ankle pump. We're going to do a lot of things to reduce that risk. While we're on this slide, though, what I want to tell you is that swelling is very normal after surgery. It's 100% normal, I'll tell you. You're going to have swelling, whether it's in the knee or in the hip. Gravity is going to come along and it's going to pull that swelling down your leg, whether it's the hip or the knee. It's going to pull it down your leg, down to the foot and the ankle. So it's very common to see swelling towards the foot and the ankle right after surgery. A couple days afterwards, you wonder why you can't get your slipper on. That's very normal. The other thing that's very normal after surgery is bruising. You're going to often have bruising around the hip, around the knee, sometimes in the thigh. And bruising is not a sign of a blood clot. It's just bruising, and you've just had surgery. So it's normal to have bruising. Plus, we usually put you on a blood thinner such as aspirin, which can potentiate some more bruising. But again, that's not a blood clot. And guess what? Gravity is going to pull that bruising all the way down your leg to your foot and ankle. So sometimes you'll see bruising in the toes. Why does that happen? Gravity. And that will get better and that will go away. Nothing to worry about with that. Now, signs and symptoms of a blood clot are usually, let's just say, for example, it's a couple of weeks after surgery, you're doing fine, and all of a sudden you get this pain in your calf, like in the middle of your calf, and you're like, that's weird. Why do I have this sharp pain in my calf? And it's usually a combination of pain in your calf plus swelling that does not go down with elevation of the leg. So pain in the calf and swelling that is not alleviated by elevation of the leg. If you're concerned about a blood clot, you would want to contact us, usually through My Health at Vanderbilt is probably one of the best ways. I'm going to give you some phone numbers that you can call as well. So if we are concerned about a blood clot, we would probably send you for something called an ultrasound. If you're here locally, we would send you to a Vanderbilt facility to get an ultrasound. It's just a scan on the outside of your leg where we look at the blood flow. And if you do have a blood clot, we have stronger medications that we can use to help dissolve that. If you're out of town or a weekend or something like that, we may have you go to the emergency room to get an ultrasound, and you would simply just call us and we'd walk you through that. I'm going to give you some numbers that you can call if you have those concerns. So that, and again, pulmonary embolism, signs and symptoms of a pulmonary embolism would be shortness of breath, where you just can't catch your breath, you have chest pain, maybe coughing up blood, something all of a sudden like that. And in that case, we'd want you just to bypass us and go straight to the emergency room or call 911 because that's a little bit more of an emergency. But then again, extremely rare with that. So I'm going to show you a picture of, I don't know if it's going to, well, it's not going to show up on my screen. It was an example of a swollen extremity, just to kind of really illustrate for you that you can have some significant swelling in the lower part of your leg going down, and sometimes you'll even have some blistering to the side of the incision, which sometimes is secondary to swelling. So we're not so concerned about that. I will, while I'm talking about this a little bit, talk about tape. If you can avoid a lot of extra tape on your skin around the dressing site, that would probably be preferable. I'm a big fan of leaving the incision open to air when things have kind of dried out a little bit after a few days. But you know, if there's a way to kind of just lay the dressing on there without using a lot of tape or using elastic over top of that, that might be best, because I have seen some blistering from tape. So the nurses will show you how to do the dressing while you're in the hospital. You simply want to do a dry dressing change daily. Again, when that swelling or the drainage has slowed down and stopped, you can leave it open to air. In terms of wound care, it's very simple. We're just going to have you, when you get home, you can actually shower, let water run over the incision with soap and water. Don't scrub it. Don't use any ointments. Do not submerge it until it's completely healed. And that's going to be many weeks after surgery. But it is okay to let water run over it in the shower. What's normal is to have what we call a big, long, complicated word, serosanguinous drainage into the dressing. What that is, it's like a golden color drainage into the dressing. So I'm going to show you this again. This is, I don't know if you can see this color here, but see this kind of golden color here? Well, that golden color is what you would be seeing, which is normal. It's actually just kind of a mixture of some a little bit of bleeding with some fatty tissue that kind of makes that golden color into the dressing. So that's okay. You'll see that. Signs and symptoms of an infection would be, different drainage, like pus-like drainage, or redness that is increasing, or red streaking. But really the biggest signs and symptoms of an infection would be a fever greater than 101.5. 101.5. It's normal to often have a low grade temperature, like 99.9, not a big concern, even 100.3 or something along those lines. It's just telling your body to get up and get moving. Those kind of temperatures can be normal after surgery, but again, 101.5, we want to know about it. There could be something else going on, maybe with the urinary tract or with your lungs or something along those lines. So just let us know about that. So you didn't know this, but there's going to be a test. So I'm going to go through a couple scenarios here with you just to kind of get going back to blood clots here. So scenario 1, 3 weeks after your surgery, you wake up, your leg is a little bit less swollen than it was the previous night. You get up, you move around, you have some pancakes for breakfast, you do your physical therapy, a little bit more swollen. So you ice and elevate your leg for half an hour and then the swelling goes down. It's sore, but not really painful. What do you think about that scenario? I'll give you a second. I'm going to take a drink of water while you're thinking about that. Well, hopefully you got this answer. This is normal. This is a normal scenario. This is a cycle. So what will happen is you'll have more swelling after you do therapy, usually after you've been on your leg all day, and then when you ice and elevate it, the swelling goes down, and often it goes down after nighttime. So this is kind of a normal cycle that you will expect day in and day out, and again, it will progressively get better over time. So that's scenario 1. Hopefully you got that. Scenario 2, 3 weeks after your surgery, you wake up, your leg is swollen and achy, feels tender, your skin feels a little bit tight, so you get up or move around, you have your pancakes again for breakfast, you ice and elevate your leg. The swelling does not go down and it hurts, and I would tell you that it kind of hurts maybe in the calf area. What would you do in that scenario? That's right. I think you got it. It's this is a concern that it could be potentially a blood clot. We don't know for sure. So you would give us a call, and so you would give us a call at the office or send us a My Health at Vanderbilt message. I'm going to give you 2 numbers on the screen there. The first one is our office number. This number you would give us a call during normal office hours between 8 and 5, and then if it's after hours or a holiday or the weekend, you would call us at the bottom number here, the 322-5000 number, area code 615-322-5000, and you would ask for the orthopedist on call to say, hey, I had surgery with Dr. Pukowski or Dr. Engstrom or one of the surgeons, and just tell them what's going on, and they'll get you to the appropriate person, and they'll walk you through it. So there's those numbers. Hopefully you've had a chance to write those down there. Those should also be in your packet that you should have received in the mail. All right, scenario 3 this time, sudden shortness of breath, chest pain, fast heartbeat, coughing up blood, or fainting. Yeah, not good things. So in this case, you just want to call 911 or go to the local emergency room, potentially a pulmonary embolism in that case. So all right, you did well on this part on blood clots. Again, this is all educational for you. Just it's good just to be kind of aware of these things and what they are and some of the terminology behind them. Things that we're going to do to reduce the risk of blood clots, or we're going to get you moving. We're going to do those ankle pumps, which I showed you. I'd like you to elevate the leg above the level of your heart. What that means is if you take a level of your heart and go parallel with the floor, your legs should be at or above that level. And the way you would do that is take several pillows to elevate that level, that leg above your heart. Now, two caveats to that is if it is a knee replacement, you don't want to put pillows directly underneath the knee. Although it's a little bit more comfortable to do that, it's not good in the long run because we're going to tell you the most important thing after a knee replacement is range of motion. We want that knee to go all the way straight to 0 degrees extension, and we want you to be able to bend it as well. But if you put a pillow underneath the knee and you constantly keep a pillow underneath the knee, you can imagine the knee is going to want to heal like this, which is no good for the way you walk. It's going to cause you to have a limp. So it's really important to get that knee straight, and the way to do that is to slide the pillow towards the end of your leg, towards the kind of towards the bottom, like right under underneath the lower part of your leg to get that leg straight. A little bit more uncomfortable perhaps, but better off in the long run. If it's a hip replacement, we're going to talk to you about some basic precautions. We don't want you to cross your legs and usually bend more than 90 degrees for the first 3 months after surgery, just to allow some of the tissues to heal around the hip. Some basic precautions for you. So in terms of a hip replacement, when you elevate, it just means you have to lower your torso back further. Instead of, we don't want you to flex forward. So it's that hip angle, this angle here, we don't want you to get something off the floor and go beyond that 90 degrees. But it is, if you lower your torso back, then you can get that leg up above your heart. I hope that makes sense to you. And we can always help demonstrate that in the hospital as well for you. So again, things to reduce blood clots, getting moving ankle pumps, elevation above the level of your heart, again, which will help that swelling, which will minimize the risk of blood clot. Blood thinning medication, traditionally we'll put you on a baby aspirin for twice a day for 6 weeks afterwards. Sometimes we'll put you on different blood thinning medications if you have a family history of a blood clot or you're at high risk. We may put you on something different like Eliquis or Pradaxa or Coumadin or something along those lines. You may get compression stockings. Those would be those tight white stockings. We would make that decision in the hospital. And again, avoiding long distance travel for about 6 weeks afterwards. So we know that people have to travel. And so it's just, if you do have to travel, get out of the car about every hour and walk around for 10 minutes and do those ankle pumps. You will have more swelling after you travel, but minimizing travel for at least 6 weeks afterwards will help. Just to let you know, your joint cannot be harmed by airline travel. So it's not gonna, the pressure is not gonna hurt anything. You may allow a little extra time at the airport, just as the scanner kind of goes around you, they'll see that you have a joint replacement, and you just may let TSA know that you have a total joint, but they'll see that on the scan as you go through security. And it may, yes, you probably will set off old-fashioned metal detectors. If you have that scenario, let us know at your post-op appointment. We can probably give you one of those little cards that tell people that you have a joint replacement in there. So, and then we say aisle seat just to kind of, for the concept of moving around in the airline. All right. So you did good on that, those questions here. This is a big, busy sheet. Hopefully you received this in the mail, but a lot of these things we've already talked about in terms of signs of a blood clot. We've talked about travel. We've talked about bathing. We've talked about signs of infection. And we're going to talk now a little bit about pain. So I want you to be familiar with these happy faces here and sad faces. They're just an easy way to kind of picture pain. And so we want to quantify your pain on a level of 1 to 10. And so 0 would be no pain at all. You're happy, you don't feel anything. 10 would be the worst pain you've ever had in your lifetime. And it's just debilitating sort of pain where you can't talk or breathe. It's just miserable. So hopefully we're going to have you down on the lower end of that scale. I will tell you this, everybody's pain threshold is completely different. Um, some people do well with pain medications, narcotics, oxycodone. Some people don't do well with narcotics at all. Uh, and so everybody's going to be a little different. So we're going to customize a pain regimen for you that works well. It's usually a combination of a narcotic such as oxycodone plus Tylenol plus an anti-inflammatory like Celebrex, maybe a nerve modulator like Neurontin, gabapentin, something along those lines. But we're going to figure out what works best for you and send you home with that regimen and send those medications electronically into your pharmacy. But in terms of the scale, the nurses are going to ask you, hey, what's your pain? And what you want to respond with is a number between 1 and 10. This will help us quantify your pain level and treat it appropriately. I will tell you that often after surgery, you may have a nerve block, and you may wake up after surgery and say, hey, I really don't have much pain. This is great. But with every block, there is a time where it will wear off. And if it wears off, it will wear off and your pain level will go up. So our goal is to try to get that pain medication on board. So as that block wears off, there's not a big transition. There's only a minor step off there, but that is a normal occurrence that can, the pain level can initially go up when that block wears off. So we want to get your pain under good control there and get something that works best for you. So just so you know about that. Things that we're going to do to reduce your pain. One thing is we'd like you to read National Geographic magazine. Picture, I love this picture. It's a lady reading her National Geographic. I love that. I grew up with those. But seriously, we want you to get moving. We've talked about the importance of moving for many reasons, and actually getting moving increases your circulation and helps get the nutrients to where they need to go and the pain medication and all of that. So it's actually good to get up and get moving and get your blood circulating. Elevation above the level of the heart is critical. And it's normal to have swelling for a couple of months after surgery. So elevation above the level of your heart. Elevation when resting. We want you up walking and moving, but at the same time, when you're not walking and moving, we want you elevating that leg above the level of your heart. Now, ice packs, very important. I'd say ice is your friend. If you could ice 5 or 6 times a day, that would be wonderful. 20 minutes at a time. You can get traditional ice packs at Walmart or Walgreens or places like that. You can also get, you can make your own. You can get frozen peas. Those work really well. They mold around that area. I recommend you probably put those in a Ziploc bag just in case they leak. You can make your own ice packs. I don't know if you know that. You can take 4 parts water to 1 part alcohol. 4 parts water to 1 part alcohol. You put them in a Ziploc. Maybe add a little food coloring so you know what it is, and then they make a nice slush that kind of molds around that area. So that's another good thing that you can do. And of course, taking your pain medication. I will tell you that the laws of the state of Tennessee have changed. Often we'll have you sign a consent before surgery that allows us to prescribe narcotics to make sure that you are aware of the risks and potential complications with narcotics. And so often even pharmacies or insurance plans will often fill half your dose for the initial prescription, and we have to fill it a little bit later. It gets a little tricky sometimes, but we'll work with you. Just please contact us with that, and we're going to make sure you get your pain medication afterwards and try to keep you as comfortable as we can. I will tell you that probably the most important times to take pain medication are an hour before therapy to get it on board and working, and then maybe at nighttime as well. And there are some complications with pain medication, and one of the biggest complications, is constipation. So that's a big problem with any kind of narcotic. Narcotics kind of slow down the gut and clogs your pipes up. So things that we do to help that are, we want you to get moving, walking again. The benefit of moving really helps. Tapering off your pain medication will help that as well. Drinking plenty of water. I usually recommend electrolyte containing beverages such as smart water, things like that. If you sometimes drink too much water, it can cause your electrolytes to go off a little bit. So sometimes some electrolyte containing beverages like Smart Water or Encore, you can get that at places like Kroger. Those are good. And plenty of fiber in your diet as well. If you have a favorite laxative, or go ahead and get that, whatever works for you, whether some people are fans of Ducalax, some people are fans of Miralax, whatever works best for you. We will send you home with a prescription for medication to help with constipation, but this is a big problem with any narcotic, so just be aware of that. Almost have you have a little bit of loose bowel and be constipated, because that can be pretty miserable. So your Vanderbilt preoperative evaluation appointment is often we'll try to do this by phone. Sometimes you need to do this in person, but this is where we go over your medical history by somebody in the anesthesia department. Sometimes I'll do that with you over the phone. And this is really just to make sure that we have everything correct, all your medications, all your allergies, your complete medical history. We'll also order necessary tests such as routine blood work before surgery, which is a requirement before surgery. And sometimes you need additional testing or clearances. So we'll talk about that at this visit. That's what, well, at the VPEC visit. So that's what that's for. So things that you'll have before surgery will be that VPEC visit, your joint class, which you're doing right now online, and those are the main things. So caregiver support, so important. It's so important to have somebody there with you. I know this slide is a little bit of an older slide, but it says 2 days, but really I want to point out that it's really the first, well, it's good to have, I think this is right. It's actually good to have somebody with you for the first couple days afterwards, just to kind of be there with you, attend to any needs that you have. You'll, of course, need a ride home from the hospital. And it's so good to have somebody there just to take you to doctor's appointments, go grocery shopping, do all those things, taking care of pets, all of those things that you'll need. Caregiver support is so important. So we thank you for those people that step in and help out during this time here. All right, this is a picture of things that you'll need before surgery. We'll give you a prescription. We talked about a walker to bring with you in the trunk of your car. Some other things that you may need would be an elevated commode. This is not usually covered by insurance, so you'll have to get that at a medical supply store. This will help especially with hip replacement surgery, so you don't have to violate that hip angle and go down too low. It makes it a lot easier. Shower chair sometimes is helpful to get in and out of the shower there. Common sense things like this is a night light here just to navigate around the house. These are the constipation medications that we talked about. Ice packs are here. Things to think about are a non-skid mat outside the shower or the tub, very important so you don't slip. I have seen a couple people slip over the years, so be careful about that. And non-skid shoes, preferably a shoe with a back to it that has a non-skid bottom. Clogs and flip-flops are not good. People trip on those all the time. So those are things that you would need before surgery. Things that you would need and I'm missing a slide here, but these are things that you would actually need in the hospital. So hopefully you can see that. But this is what you would need to bring. So this is a picture of a robe. Remember, you're going to be walking up and down the hallways while you're in the hospital. So a robe is good. If you don't, we'll have those hospital gowns for you. We say athletic shorts, but really what we mean is just something that you can get on and off easily so we can look at those incisions really well. And something to change into afterwards, something loose fitting. I talked about the non-skid shoes. bringing a pillow and a walker for your ride home. Remember, leave your valuables at home, any jewelry, no clogs or flip-flops. Do bring a list of your medications, your insurance card, and driver's license with you to the hospital for check-in. You should already have your post-operative appointment set up. If you have any glasses or hearing aids, go ahead and bring those. I recommend that you bring those in a pre-labeled case so we can identify those for you. If you have a CPAP machine, if you have sleep apnea, please bring your CPAP machine with you. And then any favorite toiletries, go ahead and bring those as well. Now, this is a picture of check-in at the hospital. So they'll be expecting you. This is when you get into the holding area. You'll have your loved one sit there with you. I will tell you that, so they'll get you in a gown and start an IV and all that sort of fun stuff there. And then right before surgery, when they roll you back for surgery, your loved one will then go to a waiting room. I will tell you that even though the surgery is maybe a couple hours for your loved one, I always tell loved ones that sometimes it can be 6 or 7 hours. And why is that? Well, there's a lot of steps that occur that you don't see behind the scenes. So when you roll back to surgery, you're going to talk to the nurse anesthetist and an anesthesiologist, and they're going to spend some time with you doing that. Then we're going to get you back into the operating room. You're going to have a whole team of specialists there just for you, getting you all set. By then, you're not going to remember much because you'll be in happy land. But there's some time involved in getting you all set up for surgery and getting you all ready. And then you actually have the actual procedure. And then after the procedure, then you go to this place called the recovery room. And in the recovery room, you're there sometimes for a couple hours or longer, where you have one-on-one nursing. Now, the nurses will call your loved one in the waiting room. There's a big waiting room there where they can call. Maybe during COVID-19, they may have to call people instead, but in any event, they'll call family members to give them updates. In the hospital, there is a little cafeteria in there right by the waiting room. I usually recommend that loved ones bring a book or a computer to work on while they're waiting. And then finally, afterwards, you'll get up to the orthopedic floor where you usually stay with us overnight afterwards. In normal circumstances, people would usually be allowed to stay overnight. I think just with some of the new restrictions, I don't think that's happening right now. So those are some pictures for you. I have a little video. Oh yeah, here we go. This picture kind of came up now. So this is a picture of preparing your house for home. Tell me everything that's wrong in this picture. So when we look at this picture, there's a lot of things wrong. And I'm just going to point them out here for you. So a lot of clutter. Imagine trying to get around in this place here. You're tripping over things, bags, clutter here. Carpets, loose carpets are a big thing. So make sure you have your house well prepared. We're being funny, somebody's foot sticking out here to trip you up. And think about things that are up high above the fridge here. If you've got a favorite French press or popcorn maker, whatever it is, get it down so you can get to it at a low level. We don't want you up on the ladder. So just preparing the house for after surgery is important. Hey, there's a picture of Dr. Pukowski in the operating room. I told you they would wear spacesuits, and again for your protection, just to kind of give you an idea of what that looks like there. All right, now this is a video made by one of our nurses, award-winning video by one of the Vanderbilt nurses on how to fall out of bed, or really how not to fall out of bed. So remember, I talked about having a nerve block. Sometimes that leg doesn't work quite the way you think right after surgery, because it can be like a wet noodle. And so I want you to watch this video and tell me what you think about it in terms of watching her trying to get out of bed here. And we will see if I can get this to play here. All right, may have to come back to that. But essentially this video, it's actually a pretty hilarious video. But in this video, uh, our nurse is trying to get out of bed and she's all tangled up in the IV and the bed's too high and she has her rails down and she has the slippery socks on and she just makes a mess of trying to get out of bed and pretty much hits her socks on the ground and starts to slide down. It's kind of a comical video, but it's really essentially to tell you the fact that please call before you get out of bed. It's really critical that you call for help. We have nurses, we have techs, we have students, we have all sorts of people there to help you get out of bed. So call, don't fall. Very, very important concept right after surgery. All right, we've talked about changing the dressing, showering, fighting infection. I want to talk a little bit about dental prophylaxis. The 2017 guidelines from the American Academy of Orthopedic Surgeons say that you do not need prophylactic antibiotics for routine dental work unless you have diabetes or immunocompromised medical condition. Rheumatoid arthritis falls into that. So, but by and large, we want you to wait at least 3 months after surgery before you do any elective dental work. So if you have any questions about that, let us know at your postoperative visit, and we can always send in an antibiotic for you if you meet one of those criteria, such as diabetes. The whole concept of prophylactic antibiotics is just to take an antibiotic an hour before any dental work to reduce the risk of infection at the time of just stirring up your gums if you have any bleeding or something along those lines. So my health at Vanderbilt is so important. Hopefully you're set up for this. Usually you have to be set up at an actual physical location for that, where they authorize you for that. But this is probably one of the best ways to get a hold of us. Our nurses are absolutely fantastic. If you send a message, let's say, for example, to Dr. Polkowski or Dr. Angstrom, if they're in the operating room, one of our nurses is going to be watching their inbox, and they're going to pick up on that message, and they're going to be able to get back with you through a secure app at My Health at Vanderbilt. You can use it on your phone or on your computer. It also links into your pharmacy and other ways that we can send in medications. So that's probably one of the best ways to get a hold of us. And I also let you know that you do have those the phone numbers that I gave you earlier to call. So the next part is really physical therapy. Physical therapist does the second part of the class, but it's just showing you some exercises to do. I'm not going to go through all of these exercises. They're basically some pre-exercises that you can do just to kind of work on some things, but I know the physical therapy portion of things are going to do things like bicep curls, moving your biceps up and down, doing tricep extensions, moving up and down from a seated position to work on arm strength. Heel slides are when we kind of move your leg up and down. Hamstring curl is just lifting your leg up and down there. Hip abduction induction is when you're moving your leg in and out. And those ankle pumps are so important. We talked about those as well. There's some other exercises such as knee extensions, moving your knee up and down, and working on squeezing the glutes or the butt muscles there. And all of these things that they talk about. But a lot of these they we'll talk about after surgery, and make sure that you are confident and walking up and down the hallway adequately, and going up and down stairs, and doing all the things that you need to do to have a safe environment at home. We do want you getting out and doing physical therapy 3 times a week for 6 weeks, so it's really good to get moving. So I'm just going to kind of move through some of these. And just let you know that we are here for you. We want you to have a great outcome after surgery. And hopefully this information has at least helped you prepare a little bit for joint replacement surgery and answered some of those questions that you may have and alleviated some of those anxieties. So we look forward to you having a great outcome after your surgery, and I look forward to hopefully taking care of you afterwards. Take care.